Okay, well, my name is Pam Larson, and I'm from Honolulu, Hawaii. And I came to the Core Institute for Dr. Jackson, and I had a fusion, a 3 vertebrae fusion of the L45S1 with a little cage and 4 screws in the back.
Pam had been a spine patient for many years. She underwent a fusion in the lowest part of her spine over 20 years ago. When she started having pain again, she did a lot of her own research and came to me for treatment.
The symptoms that I had before coming to the doctor, any doctor, was sciatica pain down the left leg. And anybody who has had any back trouble knows about sciatica pain. It starts in the low back, actually in one of the fannies, and it'll just radiate down one or both legs. And by the time it got to be really bad down past the knee to where I could hardly walk, I knew that I was going to have to come back to the mainland and see Dr. Jackson and find out what was going on, because I had seen several physicians in Hawaii and we never could get to the bottom of why I was getting worse and worse with this sciatic pain. This pain that I had, the problem affected my daily life in absolutely every aspect. I take these exercise in the pool classes for arthritis, and they're very simple, easy exercises just to keep people with arthritis moving. I couldn't even do that, and which was really sad because it's a great bunch of people, men and women. There are about 30 of us, and it was more social as well as just moving, but I couldn't even go down and do it. I couldn't walk into the pool. And then during this particular time too, our daughter got married. She wanted to come home, and she got married at Kualoa Ranch in Hawaii, and it was fabulous. But I was so out of it that, thank heavens, it was videotaped, because I watched the videotape and say, oh yes, now I remember. But I couldn't dance at my daughter's wedding, but at least I made it. And I made it walking her down the aisle with my husband. Hurricane Anna hit right at that moment. But at least I made it down the aisle, and then I could sit down, and I never got out of the chair because of the pain.
Before surgery, Pam's biggest complaint was she couldn't stand and walk very far. She would get pain in her back and pain radiating down her legs. This limited her ability to participate in really any of the activities she enjoyed.
This pain affected my daily life in absolutely every way possible. Going to bed at night, I never got a good night's sleep, so I'd wake up in the morning and not feel really good, and the pain would begin right away. Simple chores like going to the grocery store, I'd hang over the basket and just kind of move down the aisle and reach for something. And if anything was higher than about my head, I'd have to wait till somebody came down the aisle and ask them, would you get that for me, please? I couldn't do hardly any exercise. Walking was a joke. I did physical therapy, several different types of physical therapy. I did the pool exercises. I went to a pain management clinic, and they gave me some shots. Then when they got down to the fact they were going to put this machine in my back with wires coming out attaching itself to my spine, I figured, no, that's not really an option that I want. I'm going to come see Dr. Jackson.
Well, Pam had a fusion done in her lower lumbar spine 20 years ago. That was done in a traditional manner where they opened up her back and laid bone graft down along the sides of the spine. She had a long and painful recovery from that surgery, and it made her reluctant to seek another surgery. Pam had broken down the level above her old fusion. She had instability and her spine was moving abnormally. This was causing the nerves that go down to her legs to be crushed and irritated, and resulting in quite a bit of pain both in her back and her legs. The treatment for this was to position the bones back where they belong and fuse them together stably. There's a number of ways to do this. Traditionally, this is done through an open procedure through the back, other ways through the abdomen, and even through the side. In Pam's case, we chose a minimally invasive anterior inner body fusion, where we made an incision in her abdomen We're able to move the contents of her abdomen out of the way and get direct access to the spine through a relatively small incision. The benefit of this procedure over some of the other approaches is that we don't have to dissect or injure any of the muscles surrounding the spine. We're able to take the disc out and move the bones back where they belong and put a spacer in that holds them there and allows the bone to heal through the spacer. The second portion of this surgery is to stabilize everything with screws called pedicle screws. Again, traditionally these are done through a large open incision where the muscles are stripped away from the spine and held in place while the screws are placed directly in. Oftentimes with this traditional approach, the muscles get irritated and actually scar in and become non-functioning, which results in a lot of back pain after surgery. We're able to do it with a muscle-sparing approach through very small holes where the screws can be placed directly into the spine without having to strip or retract any of the muscle. This is what we did for Pam, and she, I think, noticed a substantial difference in the recovery from this surgery as her previous surgery, which was done 20 years ago in the more traditional manner.
Oh, the Core Institute has given me my life back. I wake up in the morning, I've had a good night's sleep, I can function as a human being, I don't take pain medication. Dr. Jackson, when he operated on me, after 1 week, I stopped taking the pain medication and haven't had to take any since. It's just been, well, I have my life back.
Once somebody has instability of the spine to the degree that Pam did, it really doesn't recover. Had she waited, she would have continued to have pain and disability, and she wouldn't have been able to enjoy many of the things she's able to enjoy now since she's had her surgery.
Boy, the most valuable aspect of my experience with the Core Institute was just, I would say, the whole thing. Feeling comfortable. As a patient, you want to feel that you're really in the best place. And I felt like I was in the best place. I know I'm in the best place, and that is with the Core Institute and with Dr. Jackson.
After undergoing an anterior interbody fusion, the thing most patients notice is their abdomen or their belly feels a little bloated. They get a little backed up, and for a couple days there is some abdominal discomfort. Generally, I get my patients out of bed the very next day. They start walking and working with our physical therapists. They don't require much in the way of pain medication after the surgery because we don't have to do much muscular or bony dissection to get to the spine in an anterior manner. Most patients are in the hospital between 2 to 4 days, and most can go home after surgery. I generally do not require any kind of brace or significant restrictions after this surgery because the hardware and implants we use are quite stable.
Well, now that I'm pain-free, I am looking forward to dancing with my husband. I am looking forward to walking a lot more. I love to walk around ruins in various foreign countries, walking through airports like a human being and not having to wait for the little cart to come and take me places. Going back into the swim class, the arthritis in the pool, teaching the class, and just living my life to the fullest.